So you'll go for periapical radiograph to see any periapical lesion underneath behind the root of this tooth. So depending upon your clinical examination. And there is sometimes missing tooth, most commonly third molars and canines. So you need to go for radiographs to determine whether there is any tooth present. If a canine is impacted, whether you will extract it or you will go for orthodontic treatment. Depending upon your radiographic assessment, you will go for further treatment. Or for third molar, you need to extract this one. Otherwise, it may cause harm to the the second molar, either it is molar upper or lower. So now we know why we need this radiograph. But you need to choose which radiograph should be taken in which particular cases. Okay, this is also very important. Okay, so as I mentioned earlier, if you need high resolution, high details with limited coverage, sometimes only 2 or 3 teeth you want to see. You want to see the proximal surface of the tooth. You will go for definitely the bite-wing radiograph. Bite-wing radiograph will give you the best resolution and high details, fine details of the disease or carious lesion. Okay, for we use the intraoral radiograph. If it is impacted canine in any jaw, you may go for occlusal view if it is available to you. Obviously, CBCT is helpful, or nowadays CBCT is much more common. But if you don't have CBCT, you will go for occlusal view, either symmetrical or asymmetrical. But if you want to see the multiple sites, patient have multiple chief complaint or maybe one chief complaint, but in your clinical examination, you found out that multiple teeth are cariously. There are some broken teeth or BDR, broken root there. You're suspecting there is a swelling, periapical swelling. So you need to see all this all together. Then you go for panoramic radiograph. Or sometimes who want to be orthodontist in future, for all of your patient, you need to go for cephalometric analysis, the extraoral review. Or sometimes you are working in a remote places, in a small town, that their MDCT, CBCT, or MRI is not available. But you need to determine the exact location of this disease or any fracture cases. Then you need to have multiple extraoral view, PA view, Riverstone view, Walters view. So these are the extraoral view. It may help you. Maybe you need to refer this patient, but you need to give the primary treatment of this patient. So you will go for this extraoral view. So you need to know these techniques to have the diagnosis of this disease. So in the book, they have mentioned this one for the resolution, and the cover is the periapical, bite-wing, and full mouth periapical. They have limited coverage, but for the carious lesion, periodontal, or some hidden diseases, carious lesion for bite-wing or periodontal bone level for vertical bite-wing, and in the 20 cms full mouth periapical, you will give if there is any carious lesion, periodontal disease, dental anomalies, or any other hidden diseases, small cyst or tumor. You may see in this radiograph. In occlusal view, we will give you the moderate, maybe one particular jaw, either it is maxilla or mandible. If you have any anomalies, occult disease, or salivary gland stone, especially in the lower jaw, and expansion of the jaw in case of any benign tumor or cyst of the jaw. So you may go for occlusal view. The panoramic will give you the broader, the whole bone jaw with the surrounding structure, so that you can detect the anomalies, any kind of CS tumor, malignancy, if there is any multiple teeth carious lesion, periodontal disease, periapical disease, or if there is any TM joint dislocation. So you need to go for panoramic radiograph. Okay. Other 3D views. 3D views, most commonly we use CBCT. CBCT, you may see now it is very common here for simple implant site assessment or third molar or canine infection. We go for CBCT, limited field of view. TM joint dislocation, if there is any craniofacial abnormalities, dental abnormalities, malignant lesion or fracture of the jaw, we go for CBCT. Also, if you don't have CBCT, you have CT, you may go for that one also. But remember that exposure of ionizing radiation is much more in the CT or MDCT comparing to CBCT. So extent of the craniofacial disease, fracture, implant site assessment for, you can go for CT or MDCT, but for implant, it is better not to go for CT for a simple implant cases. So we are exposing the patient. MRI, most commonly, we go for TM joint dislocation. If you are suspecting there is a disc dislocation, you will go for MRI, and any malignant lesion which is embedded into the soft tissue, you will go for MRI. And a skull view, if there is any fracture, anatomical dislocation, or any kind of systemic disease, which is also involved in the skull of the lesion, skull, so you will go for skull view. And also in the CBCT, you may go. But best possible 3D is the CBCT. So because we have this, we have this advantage in the CBCT that we can choose small field of view, medium field of view, or large field of view, or full skull view, depending on our need. So, in a short, if we want to conclude the selection criteria, at first, as you mentioned, the historical and the clinical findings, which will lead you what type of radiograph or what information you want from this for this particular patient, then that will lead you to the particular radiograph. And each patient is different, so their radiograph need of radiograph is different. In the book, they have given a clear guideline, which I'm coming to the next, but this is not applicable for all the patients. As I'm repeating again and again, that each individual is different, their need is different, their oral hygiene status is different. So depending upon all these clinical findings and historical findings, you will choose your radiographs. Don't go for one single formula for all these patients. So when we do need to perform the radiographic examination and how we select the patient for radiographic examination. The book has given some categories for children, adolescent, and adults. New patient or recall patient, clinical disease indicator carries or periodontal disease. So we'll just review this one. But always think about whether taking this radiograph will be beneficial for this patient or not. This radiograph will give you a better information what we have already have,